Hello community and welcome. This is Kira. Quick introduction. I am a lawyer, I'm a criminologist, I'm a counselor, and I'm a social worker. So today we're going to look at, or we would continue talking about substance abuse, and I'm going to look at some situations in the United States, United Kingdom, and Nigeria. So according to the National Institute of Drugs and Addiction, addiction is now considered to be a chronic illness. Hence, addiction is a public health crisis in the United States, and not just in the United States, in a lot of other countries in the world. So in 2020, we know that substance use disorder, which is what is sometimes called substance abuse disorder or substance use disorder, affected over 40 million people in the United States. And out of that 40 million people, only 6.5% of the people received treatments or any form of help. Now, 107,000 people died of drug overdose in 2021. And then there was an increase in drug-related deaths amongst middle-aged men or people who were of the ages between from 35 and up. At that same time, it's interesting that there was a decrease in drug-related deaths for people within the age group of 15 to 34 years old. So 35 and over, there was an increase in drug-related deaths, and then decrease in drug-related death for 15 to 34 years old. So I think that's an interesting data. And then we also know that adults from ages 65 and older had the largest increase in drug-related overdose. And I was surprised by that, that people from the ages of 65 and above had the highest group that had drug overdose, or that, highest group with drug overdose. So from 2021 to 2022, there was a 10% increase in drug-related death. So this is, this data is seriously concerning, and we must find means to eliminate any form of drug use in the world. Now let's look at the United Kingdom. In 2023 to 2024, about 30% of the people in England and Wales between the ages of 15 to 59 actually admitted that they had tried cannabis at least once in their lifetime, within their lifetime. They tried cannabis. That's age group between 15 to 59. That was the highest. 30% of people, said they had done that. Now, cocaine came in next with 10.5% of the people, admitted to having tried cocaine. About 10.5% admitted to having tried cocaine. And then 9.6% of the people admitted having tried ecstasy. Now, it's interesting that the death of cannabis-related deaths in England and Wales in 2023 has been the highest in 30 years for that group, and the number of people that died from that from cannabis. So we had 32 people who died from cannabis in 2023, and that's the highest, like I said, in the last 30 years for cannabis. Now, the lowest for cannabis death or death related to cannabis was in 2011 was 7. I mean, I can't say only 7, because one death is one death too many, or one death too much, or whatever. So in Nigeria, we know that the National Bureau of Statistics in 2018 expressed that there's been prevalence of drug use amongst people between the ages of 15 to 64, between the ages of 15 to 64. And that was 14.3 million people, or 14% of the people between the ages of 15 to 64 use drugs in Nigeria. So this is really, really concerning, in the three places. We've looked at United Kingdom, we've looked at United States, and then Nigeria. So the use of death is really, really, concerning. Um, the effects of drug use or drug abuse on children is also a major issue, because when, say, a mother is pregnant with a child and she's using drugs, like if you look at my previous posting, I looked at an inspirational writing where a young girl, 14-year-old, maybe 15-year-old, was using drugs and she was pregnant and she was going to give birth to a drug addicted baby. And so I spoke with her and wanted to find out how she got addicted to drugs. And, she said she's always had the love of, her lover, introduced her to drugs. Come to find out at the end of the day that the lover she was talking about was drugs, because she herself, this 15-year-old or 14-year-old girl, was born with drugs in her system. Her mother was a drug addict. Yeah? So she was a drug addicted baby also. So, it's drug use can be generational. And we now see that in this situation I just gave, the grandma was using, the mom was using, and now the newborn baby is going to be born with drugs in the system. So it's really very, very concerning. And some of the effects that this child that is going to be born, or any child that is born with drugs in the system, is that it could lead to developmental delays, for that child. The child will not be on the same developmental or cognitive, or might be cognitively impaired, will not be on the same developmental level with kids of his or her age group. So her development may be delayed. It can also lead to birth defects. The child might be born with some physical defects because of the drug use that the mother was exploring with during her pregnancy. Now, the drug addicted baby would also definitely not, have a good start. That child, if born with drugs, would have withdrawal symptoms. And obviously, that's not a good start for a newborn in the world. So that child already has some, issues with her life already. And that's just introduction to the world for her or him. So the child may also experience neglect and abuse, and when the parents, for example, are on drugs and the child doesn't really have anybody caring for her or him at home, that child learns to depend on him or herself, or maybe some older siblings in the house to help raise him or her. I've actually visited the premises where the kids were removed from parents because of drug use. And when you entered the premises, there were some, white powdery substance. You don't know if the kids might actually think that's sugar, and then, they might ingest it. So when people are using drugs, they are not in the right frame of mind to know when to ensure that things are not just lying around and the kids don't just pick up drugs, So that's a really big concern, and that's abuse and neglect of those children in that situation. And the best the system can do is to remove those children, is to remove the child or the children from that environment to ensure that they are actually cared for better. And also the kids in that situation, when the parents are not in the right frame of mind, many of them, not all, may end up being abused physically, emotionally, obviously psychologically and sexually, and that's really bad for the kids. So the kids now develop means of survival modes. They have to develop ways to survive in an environment like that, if they have to live in an environment like that. So they have a lot of emotional instability and social isolation also, because these kids are going through a lot. They see their parents on drugs, and they just have to develop means to survive. And kids should not be put in that situation, So we have to bear in mind that we have to look out for one another. We have to bear in mind that if its relatives are able to take these kids and, help the family whilst maybe the parents go into rehab, or help raise those children, that's what's going to happen. Because the children really didn't ask to be brought into that situation. And like I said, this is really alarming, but we cannot shy away from discussing this topic. We have to continuously look at the issue of drugs and how do these dealers, end up bringing drugs. We have to look at the ways they're bringing drugs into the countries. And, how are drugs getting into schools? Because we have situations where kids are bringing or selling drugs in schools also. We have situations where drugs are being handed in nightclubs and recreational centers and all that. Drugs are being smuggled in many, many ways into the society, and we have to, just continuously be on alert and, report to authorities whatever about drugs, and see how, the kids. My main concern is the children. We want to make sure they're not in drug-related environments. And so we know that drugs does not just affect poor people. Drugs, they know no bounds. They affect rich people, they affect poor people, they affect those in between. So it affects the entire community and the entire society. And this is not fair on those who are affected. The children, the grandparents have to sometimes step into the shoes of the parents, because the parents have decided not to be responsible, and they have decided to pick drugs over their children. And so we need to have this conversation continuously. So we have to be we have to be mindful, and we have to be intentional. You have to look at, for example, a parent who has been going to work regularly, stops going to work regularly, starts, looking unkempt, they don't comb their hair, or they're not changing their clothing, or they're spaced out. You have to just be aware of your environment and ensure that you don't just abandon that person. If you feel they need help, you can actually make a referral for them. You can talk to them, you can set up an intervention and see how we can help to ensure that that person gets help. I know that people are not going to get help until they're ready to get that help, but we have to continuously work hard. And we have to continuously be cognizant of the fact that, drugs, is part of, drug abuse is part of reality of life, and we have to, keep trying to curb it. So let's just, keep looking out for one another. Be kind, continue to be inspired, continue to be motivated, and be intentional. So until next time, thank you.